think about the 1960s leading into the early part of 1970s, we were launching a movement against poverty.
It is this kind of new social institution that needs to be created if social change is going to be made.
The work goes on, the cause endures, the hope still lives, and the dream shall never die.
The Great Brook Valley Health Center and the Family Health and Social Service Center have been innovators from the start, bringing quality care to those who need our help the most.
But one of the amazingly important things that I think most health centers have encountered is that once somebody leaves, you can't assume that they've left you. They may come back to where they got good health care. And I think Great Brook Valley is a superb example of that.
And I think about how appropriately named the health center is, because Senator Kennedy was such a giant in this movement.
He was such an instrumental player in the health center movement, in the health center funding. He was truly a founding father and really believed in the mission.
He knew that the almost 30 million Americans who get their health care through a community health center might not have any other pathway to care but for community health centers. So our founding mothers, our 7 founding mothers, I don't know that they had a vision for the health center other than preventing what was the current status quo at the time, where they were sending their family members and their neighbors and their friends to the emergency room for primary care.
And that's really not where you want people to get primary care, because by the time you show up at the emergency room, your problems have probably exacerbated.
Really the most significant illness that our patients had was poverty. They had lack of access to care, lack of access to critical services that are considered common for most people.
Giving people basic primary care saves billions and billions and billions of dollars on the healthcare delivery system and helps the community. You know, 1 in 7 Bay Staters get their health care at a community health center. 1 in 7.
It was really an absolutely incredible opportunity that we had to hire people who were just totally committed to the vision of the health center.
It became not only about the population that we served, but the workforce that we would recruit. Really what we did was we created a place for patients to come for care, we created a great place for people to come to work, and we created a great resource for the people who lived in the community.
No one speaks the language of the community better than EMK. No one knows the challenges of essential workers and those first responders and the poor and the immigrant better than EMK. That's the credit of an Edward M. Kennedy Health Center, and that's why we should be proud of it.
We played a critical role in the healthcare delivery system during the pandemic, but one that was envisioned by people like Ted Kennedy decades and decades before. And because of that hard work that was done over the last 5 decades, we were able to not just survive the pandemic, but thrive through it and continue to grow access to care. We're in a position now that we have only one way to go, which is to be in a growth mode and expand that access to care. We were only able to do it though because a long, long time ago, 7 brave moms said enough. Enough is enough.